And their calls hit home for our next guest, who says that she is terrified at what government-run health care would mean for 2 of her 4 children that are living with cystic fibrosis. Joining us now is the president of Students for Life of America, Kristan Hawkins. Good morning, Kristan.
Good morning. Thanks for having me.
You're welcome. So I was reading your op-ed. Tell the folks at home why you decided to write this and how this hits home for you.
Sure. Well, I've been watching these Democratic campaigns, ads, and the debates, and all the Democratic candidates are raising their hands saying that they support some form of government-run health care, of this Bernie Sanders Medicare for All plan. But it's time for people to start reading the fine print as to what that means. My children, 2 of my children, Gunnar and Gracie, have cystic fibrosis, which is a hereditary genetic disease that will end their lives prematurely. It's a very expensive disease. It costs thousands of dollars each month for their medication and very time-consuming with their treatments. And what we've seen in other countries that have nationalized health care programs, those children with CF do not receive the same amount of care my children here in the United States have, simply because they're Americans and we live in a nation that spends far more than any other nation for biomedical research and advances. The cure that we're hoping comes within their lifetime is going to come from the United States because of our health care system.
Wow, we're looking at some of these pictures. Bless your heart. Can you illustrate the problem for us? Doing your research, you talked about some examples of veterans administrations and what you've seen. Tell the folks at home what it looks like.
Yeah, when you're told from a Democratic candidate that they want health care for all, the question is, what type of health care are you getting? Is it quality health care? Because what we've seen in countries that have nationalized health care programs, you're looking at long wait times. You're looking at government bureaucrats who get to decide who gets what care. You're looking at increased costs, increased taxes. Right now, all the experts are saying it's going to be about $32 trillion for Medicare for all in the first 10 years. And even if you double all the projected tax revenue, that's not going to pay for it. And you know that spending is going to decrease in biomedical research because the incentive is not going to be there. In the UK, the National Health Service is refusing to pay for a drug that my son Gunnar has been on for more than 2 years. This drug, Rocambi, is a genetic modifier. It's very, very expensive. He's been on it for 2 years. Experts believe that this drug could lead to at least a decade of life for Gunnar. But children in the UK are not receiving this drug because their government refuses to pay for it because it's too expensive and there's too few cystic fibrosis patients for them to even care about.
How do you do it, Kristan? 4 kids, it's hard to be a mom.
Well, you know, any parent will know you will do anything for your child, and that includes speaking up, especially when something this frightening is coming down the pipeline and people aren't asking questions and we're not having a real conversation of, sure, there's things that we need to fix right here with our healthcare system, but that doesn't mean blowing up everything that we have. 67% of Americans have private health insurance. Senator Kamala Harris said that she wanted to do away with our private health insurance.
I know.
That's scary.
A lot of people are happy with what they have now. Thank you so much for being with us. God bless those children. They're beautiful.
Thank you.
You're welcome.